Vitamin B12, also called as cobalamin, important water-soluble vitamin in the body. 7. Common clinical symptoms as a practicing physician and a nephrologist, what we encounter. Starting from the first one, weakness, pallor or yellowish discoloration of the skin. This weakness more of generalized fatigue. Patient might say the fatigue is present throughout the day. The fatigue might be because of the low blood or low hemoglobin RBCs, because of which patient will have either whitish or palish discoloration of the skin. Sometimes because of the jaundice, yellowish discoloration of the skin might be there, generalized yellowing, or it might be present only in the eyes where you can appreciate it better in the sclera. Pallor in the mucous membrane, it might be more prominent. Why this anemia? Vitamin B12 along with folate is very important for hematopoiesis, that is generation of the red blood cells, and also in the nerve function and also in the body cell regeneration. So that is why weakness, which is generalized fatigue, along with that patient might be having examination finding of yellowish discoloration or mild palish discoloration. This is the first one. Second, tongue changes, also called as glossitis, loss of papillae, painful tongue. Some patient might present with loss of taste sensation or decreased taste sensation. The tongue loses the papilla, there might be some kind of cracks. In the literature, it has been described as beefy tongue. Yes, you heard it right, beefy tongue. You can Google it, the image, and see how thick the tongue might be. The second symptoms related to the tongue, glossitis, loss of papillae. Symptom might be appreciation of taste at a lower level as before. Second one. Third one, hyperpigmentation, important clinical sign or examination finding. Hyperpigmentation of the skin. Where are all it common? Especially over the joints, especially small joints of the hand, even small joints of the toe. Also, the hyperpigmentation can be appreciated in the palms and also in the soles. The hyperpigmentation without any explanation because of constant exposure or scratch, or if a patient is having some kind of job where it involves a skin at a particular site being exposed to a scratch for a long period of time, yes, it can cause hyperpigmentation. Whereas in B12 deficiency, this can occur without any precipitating factor or any risk factor for hyperpigmentation. Generalized hyperpigmentation might be there. There is a pathophysiological process which is related to it, not going into the details. Hyperpigmentation of palms and soles, also the small joints of the hand and also of the lower limb is also common. To the fourth one, tingling and numbness, another common presentation of the patient to the hospital. They will feel the numbness in the lower limb more often than not. That might not be relieved with other medications. Gradually over the days, that numbness might be worsening. The tingling might be so severe, patient need medical attention. At the beginning, it might be mild to start with as the days pass by. If vitamin B12 deficiency is not replaced, the tingling and numbness is very difficult to ignore by the patient. Eventually, they land in the medical checkup area. Fifth one, gastric symptoms, unexplained diarrhea, or any other unexplained GI problems. Even without a gastric tract infection, patient might develop diarrhea. This is because GI tract needs cell which needs lot of regeneration. For that, vitamin B12 and folic acid is an important component in the regeneration. If vitamin B12 is deficient, obviously that regeneration process will be affected. Patient might present with symptoms similar to any malabsorption syndrome, even though this is somewhat rare clinical presentation out of the 7 that I am describing. Next one, weakness. This time, specific weakness. Bilateral lower limb to the level patient might not able to use the lower limbs. That is called paraplegia. Patient presents with bilateral lower limb weakness, which is specific paraplegia. The first weakness is generalized weakness, which is because of anemia, whereas the current weakness that we are describing is more specific because of the neurological involvement, spinal cord involvement, because of which patient might present with difficulty in walking. Many a times it might mimic some other spinal cord disease, the severe form of which is subacute combined degeneration. Severe vitamin B12 deficiency can cause it. Leave out the technical terminology. Bilateral lower limb weakness patient might present with symptom. Patient might be having neuropsychiatric manifestation. Insomnia, patient might not get the sleep. Depression, if a patient is already having other risk factor for depression, obviously vitamin B12 will put the patient into the clinical depression entity. Fatigue, as I told, mood swings are common. Neuropsychiatric manifestations. So out of these 7 I described, which is the one we commonly encounter in the tertiary hospital? Jaundice, generalized fatigue, paraplegia, bilateral lower limb weakness where patient could not able to walk. Not only that, any neurological specific symptoms, and apart from that, tongue changes we usually find it in examination, and some patient might present with glossitis. And any other apart from this, visual disturbance might be there. Since vitamin B12 is an important component in the nerve functions, it might affect the vision also. Visual disturbance might be there. So these are all the common clinical signs and symptoms of vitamin B12 or cobalamin deficiency. Another question, in whom it is very common? In those who are taking vegetarian diet, pure vegetarian diet, where they omit the contents of vitamin B12 also. And there are some persons who are inherently predisposed to this deficiency. Genetic causes problem in vitamin B12 absorption in those. So in summary, vitamin B12 important for nerves, neurological, hematopoiesis and cell regeneration. Symptoms can be weakness, anemia, jaundice, glossitis, hyperpigmentation, GI symptoms, tingling and numbness, paraplegia. Any neuropsychiatric manifestation can be there. That's all for today. Next video we will see regarding another vitamin. Bye bye.